Hello, today we have another expert of par excellence, Dr. I.B. Vijay Lakshmi ma'am, who doesn't need any introduction. She has done such an extensive work on congenital heart diseases, and it's a pleasure to have you ma'am here to WCC 2023.
Namaskar.
Welcome you ma'am.
Thank you.
So tell us about your presentation ma'am that you're going to have at today's conference.
Yeah, I spoke about the interventions in pediatric cardiology. Intervention is coming between the disease and the death. The child is born with the disease and then it's certainly going to die. 80% of the children with the congenital heart disease, they die before their first birthday. So we have to intervene that. So many children are born or soon after birth, without celebrating their first birthday, they die, or they are born at the stillbirth. So we started with the fetal echocardiography with the fetal intervention, and then I spoke about the hydrops fetalis, where the aortic was pinpoint aortic stenosis. The child did not cry after the birth, and then child was on the ventilator, and I opened the aortic valve with the PTCA, that is a coronary balloon, and the child is absolutely doing well. So like that, I went on showing all the cases, rarest of the rare cases, where right from the intrauterine to this thing, and the very first time done in the world, the aortoventricular tunnel, aorto-right atrial tunnel, and coronary AV fistulas closed with the ADO2 devices, and then 9-day-old baby with the PDA closing with the device, and how the children improve, especially with the coarctation of aorta. Whatever we do intervention in the adult, their lifespan doesn't increase. It's only a palliation. But when you do it in children, you're giving the whole life, and they're completely cured. If you close a hole in the heart, AST, VST, PDA, whatever it is, they're totally normal for their whole life. So many of my children have become doctors, engineers, and all that. In the last 30 years, I have an immense pleasure that the intervention in pediatric cardiology, they are both satisfying and gratifying, and I'm very happy about it. And that's what I told. The sky is the limit. When there is a will and the skill, you can achieve anything and save the precious life of the child.
Yeah, it's really so heartwarming to see and so gratifying that you are saving so many children at the age when they are just in the growing age. Recently you had a publication ma'am in the last CSI. Can you tell us about your book?
I have edited 4 books. One is on the rheumatic fever. See, rheumatic fever, there was a time when they used to say the rheumatic fever licks the joint and bites the heart, because whatever the damage was done in the heart was not able to be detected clinically. So I came out with the Vijaya's echo criteria, where the diagnosis of carditis can be done in time, and they can be put on a penicillin prophylaxis, and they make a good recovery. Because we have seen that almost 30 to 60% of the children with the mild to moderate carditis can revert back to normal if they are treated in time. So that's how, and for the first time in 2015, this echo criteria was added as a major criteria. So that was the second edition of the rheumatic fever and rheumatic heart disease, where the echo criteria is added, and I have written 2 chapters on the echo itself in that book. And the second book is the comprehensive approach to congenital heart disease. When we were students, when I was a postgraduate, we were reading Joseph Parloff's textbook, which did not have intervention or did not have the management. It was only clinical diagnosis. So I came out with the comprehensive approach to congenital heart disease, for which Joseph Parloff himself wrote the preface, and he wrote the foreword for that. And then he said that this is an amazing book that everybody should read, and as a result, most of the countries, most of the pediatric cardiologists and the postgraduates, they are reading that. That also has come for the second edition. The third book is Intervention from and Imaging from Pediatrics to Geriatrics. And out of 72 chapters, almost A to Z, everything is covered in that. And apart from that, long back I had written step by step to echocardiography in congenital heart disease, like a pocket dictionary for the youngsters to keep it, and then whenever they have a doubt about congenital heart disease, they can look into that. So that's how I came out with the publications.
Yeah, it's really commendable efforts by you, ma'am, and so many books that you have edited. I'm very sure that the budding cardiologists,
Yes.
they will definitely learn and take messages from your book. On this WCC, because we know that it is organized on the occasion of International Women's Day, any particular message you want to give to the because you are dealing with the congenital heart diseases, so I would say that address the mothers who have babies born with the congenital heart diseases. So what kind of inspirational words you want to say to them?
In fact, I was with Jyotsna right from the beginning for this Vincars, right from the beginning. And being the first lady cardiologist of my state, Karnataka, I have trained lots of women in that, and also wrote the congenital heart disease policy, the policy for the whole CSI. And after that, we started fellowship for the pediatric cardiology, and now today lots of people are there. Now, I would like to insist that instead of having a child with the defect and then struggling later on, I insist on having the fetal echo, and then the fetal medicine must be there everywhere, so that you can distinguish between complex congenitals where like a Down syndrome, where the mentally the child is not going to be all right. Instead of having that child, the medical termination of pregnancy can be done. Or if there is other condition where immediately treatment has to be given, like the transposition. The moment the duct starts closing, the child starts deteriorating, and in such children, it can be detected in the intrauterine life and transferred to a center where surgery can be done within 7 days. So that's how the fetal medicine to this thing. Now we have moved on, and that's it.
So that's really must be a revolutionary step if we can give some kind of therapeutic procedure at the antenatal, and if it gets detected on time. So that is a very huge step. And I hope, do you have any experience like any?
No, actually I say a small step taken towards the well-being of the child, it's a giant leap.
Yeah.
Because you are giving another 50, 60 years or 70 years to the child. That's we have to go to the children. They are our asset.
So I'm very sure that with your efforts and with your guidance and with your inspiration, the fetal medicine is going to take another facet very soon in the cardiology.
Definitely. In fact, I told our Chief Minister to have the fetal medicine department in a government hospital.
That's great.
Where 20,000 deliveries are occurring every month. And he readily sanctioned it. And now we have a fetal medicine department. See, private, it costs about 30 to 35,000 for the genetic counseling. Whereas in government hospital, just 3,000 rupees, it can be done. So I think every government hospital all over the country, all the multi-speciality hospitals, they should have the fetal medicine, so that the well-being of the child is taken care of, and then the fetal wastage is reduced, and then the postnatal mortality, that is the child mortality, also comes down, and thereby the stress on the mother also comes down. So then we have to move more towards during the conceiving itself.
Yeah. So thank you so much, ma'am, for your wonderful inputs, and I'm sure that under your guidance of the Vincars and the whole Cardiology Society of India will take a new giant leaps in the future years too.
And definitely, I have a positive note, and the youngsters are so bright, and I'm sure they have the bright future, and the whole country has got good hands.
Thank you so much, ma'am, for your valuable time.